Hello. So I wish I had better news, but the reality is we are in the middle of the beginning of the surge. Our hospitals are filled, and there are lots of really sick people here. So our emergency room waits are very long. We have begun to double up if we have single-bedded rooms. So there are now 2 patients in a room. We are making accommodations and trying to hire staff temporarily to bring on to deal with all this surge. And the Commissioner of Health has convened all of the CEOs and indicated the surge may begin anywhere between the 11th and the 20th of January, where the 20th hitting the peak, and then we don't know how quickly that will fall, or it will be delayed on one model, a different model, till the beginning of February. Now, many of you have said to me, I don't understand all this conflicting guidance. I don't understand why the rules aren't just the rules. The rules aren't the rules because the variant hasn't given us a playbook, right? We're all trying to figure it out. And so the most important thing is really understanding that the things that we do know is as we look at the numbers of patients in our hospital, those individuals who are on ventilators, which means they're the sickest of the sick who have COVID, 80%, both nationally as well as within our own facility, are unvaccinated. No, the vaccine will not prevent you from getting COVID, but it will certainly minimize the impact that this virus has. So we continue to make available all of our vaccine availability within Mullica Hill and Vineland. That continues to remain open. Appointments are required. If this wasn't enough, New Jersey ranked number 1 last week on influenza cases. So not only are we dealing with the global pandemic, now we have the flu that is moving quickly. And so we're encouraging people to make sure they get their flu shots. So obviously with all of this information that I've just shared, the state continues to remain at red visitor restrictions. That means that these conditions exist on the screen above that'll show you when a visitor is permitted. I know that is very difficult. I heard from many of you about how frustrating it is not to be able to get information. We continue to try and respond as best we can, but at the end of the day, the reality is that the volume is significant and we are doing our best to meet your needs and will continue to do so. So you know that a hospital or a health system such as ours is run by community members, a nonprofit organization, which means that we invest all our profits back into the organization. We do not have shareholders. It is overseen by community members who serve very, very huge amounts of time on our board of directors. And we've recruited 2 new board members to replace individuals who are going off. Our first board member who will join us at our February meeting, Zenaida Kobian, who is the superintendent of Penns Grove, Carneys Point School District. She is a long-time advocate in the community, and we're thrilled to have another individual who lives in Salem County and works in Salem County join our board. I'm also glad to welcome Jeff George. Jeff has been on our investment committee. He lives in Mullica Hill, and he also serves on our foundation board, and he'll be joining the board in April. In addition, we are welcoming this week Lydia Stockman as the Chief Administrative Officer at Mullica Hill and Woodbury. Lydia has over 20 years of experience, trained as a nurse in the Robert Wood Johnson Health System. She studied at Seton Hall with a got-her-RN, and then her master's there as well in administration. And I'm really looking forward to working with her down here, and I'm thankful that she has joined our team. So January is Healthy Weight Awareness Month, and I don't know about you, but COVID has certainly pushed me to the wall in trying to think about creative ways to remain healthy. We actually have a weight loss program, a medical weight loss program here at Inspira, and we're glad to support you in that effort, but just remind you to look for the public service announcements, and just remember, January is a good time to start those good habits and fulfill those resolutions and get 2022 off on the right foot. Speaking of getting off on the right foot, I really want to thank Tally Ross. Tally is the recent winner of the Daisy Award for Nursing Excellence, and the nomination came from one of her own patients. And her patient said that they had long struggled with depression, and even though they were in Elmer for a clinical medical care, Tally saw the opportunity to really partner with this patient, and it really helped her get on track to really be able to begin to deal with her depression and address some things that have been lingering for some time. And so I thank this patient for speaking up and complimenting Tally, but I also thank Tally and the culture of the Inspira family to really be able to respond as needed. not only on the things you present with, but on the things that we hear you say. Until we meet again, be well and stay safe.